morning, Rocky Mount. I'm Crystal Dawes. Have you ever had a question that you were afraid to ask even your own doctor? You're not alone. Researchers show that even the most educated women sometimes struggle when it comes to asking those personal questions. So here to help us break the ice is Dr. Donica Moore, a women's health expert and advocate. Hi, how are you? Good morning.
I'm great. Thanks for having me, Crystal.
Oh, it's our pleasure. Tell us about, I understand there's a new survey. It's saying that women are really confused about their health and their bodies. Could you tell us a little bit about that?
Sure. This survey questioned women Ivy League students and recent Ivy League graduates to find out what they really knew about women's health. And these are women who've passed every test with flying colors, but this one I'm afraid they would flunk. And I think it is because we teach them all about physics and calculus and economics, and we're not teaching them Women's Health 101. So some of the basics that they got wrong is they didn't know the most common cause of vaginal infections. Many of them thought it was yeast infections, when in fact it's actually a condition called bacterial vaginosis, or BV. Many women had basic facts about how to diagnose yeast infections wrong, how to treat them, and that's kind of sad. We expect these women to know more, but we're not providing them with this information. And they are embarrassed to ask not only their own healthcare providers, but even their parents or other adults in their lives. So the important thing for them to know is that not every vaginal discharge is a yeast infection, and what they should do, and what they can do now, is a kit called the Vagisil Screening Kit, where they can test themselves in the privacy and comfort of their own home and see whether their symptoms are likely to be a yeast infection or likely to be something like bacterial vaginosis, BV, or TRIC, which they need to see a doctor about and get medical therapy.
Were there any other areas you found that we were just simply confused about?
Oh, well, there's so many areas where there's myths, misperceptions, and misconceptions. Other areas around testing that women are confused about. Of course, we've heard a lot about HPV, human papillomavirus, in the news lately. HPV is the causative agent for about 70% of all cervical cancers. Women are concerned about who gets the vaccine and who needs it. And then they also don't know that women over 30 can get a test called the HPV test from their doctor, where they can diagnose if they have one of the strains that is more likely to cause cervical cancer. There's also a lot of confusion about Pap tests, a lot of confusion about breast exams. How often and what age should women be when they get a mammogram? Of course, you should get a baseline at 35. You should get an annual mammogram once you turn 40. Lots of confusion about how do we make the proper diagnosis. And this is why it's so important for women to find out what tests they need from their doctor, what tests they can keep in their closet in their bathroom at home in case they need it, like the Vagisil Screening Kit, and what things they can safely self-treat with over-the-counter medicines like yeast infection products. They work great if you really have a yeast infection, but they don't work if you made the wrong diagnosis.
So it seems you're saying that if you educate yourself, you'll become more comfortable to talk with it about your doctor or your gynecologist.
Absolutely, and one of the easiest ways to get educated about embarrassing topics is to go to the internet. So for example, for topics related to any kind of vaginal infections and vaginal treatments and the Vagisil Screening Kit, women can go to Vagisil.com. For all other women's health topics, they can go to my website, drdonica.com. But of course, the most important place to get personalized, individualized medical answers about your conditions, of course, is from your own healthcare provider.
So educate yourself, and then you can come with the correct questions.
Absolutely. And we make a shopping list to go to the grocery store. I want women to feel comfortable making a list of their questions to take with them to the doctor, because of course we all forget things when we're in that very attractive robe that barely covers half our bodies.
I see. As far as menopause goes, there's a lot of myths that say things you can and can't do to minimize hot flashes. Is there any new news in this area?
The new news, quite frankly, is that hot flashes have become news flashes, and there's so much research in this area, which is a good thing. The bad thing is not all of that research applies to every woman. Not one size fits all when it comes to menopause treatments. So I want women who have very mild symptoms to feel comfortable self-medicating with alternative products and herbal products that they can get at the grocery store or at the drugstore. But if they're having moderate to severe symptoms, they should talk to their doctors, because there's no point in suffering in silence.
Dr. Donica Moore, I wish we had more time because this
I do
is
too.
such a serious subject and one that we all need to pay more attention closely to. So give that website address again for us.
For information about vaginal infections and the Vagisil screening kit, they can go to vagisil.com, which is VAGISIL.com. And then my website, drdonica.com, is DRDONNICA.com.
Thank you so much, Dr. Donica Moore. Can't wait to see you next time.
Oh, thank you, Crystal. It's a pleasure as always.
Have a great day. And thank you, Rocky Mount, for joining us for news, views, and interviews on WNCR TV. I'm Crystal Dawes, and we'll see you next time.